Okay, perfect. So good morning again, beautiful people. We'll start our lecture, and there are 15 students by now. So let's start by reviewing some of the previous lecture. Okay, so we have 15 students. Okay. Dental anatomy is the thing here, and this thing is important. Teeth, primary teeth, secondary teeth, primary also known as deciduous or baby or milk teeth, and secondary permanent. And then we had three elements: water, inorganic material, and organic material. Primary teeth, there were 20 teeth, begin to form during the first trimester of pregnancy, typically began erupting at around 6 months. And then most children have complete primary dentition by 3 years of age. And when the children reach at 6 years of their age, the secondary teeth begin to erupt. They reach up to 32 teeth in the most cases, and from 6 year to age of 12, they fully erupt. They form a complete set of teeth, except third molar wisdom teeth, which appears at the late teen. So these were the diagrams on the right side. So it started from the lower jaw central incisor, and then for the secondary permanent teeth, also from the central incisor, but first molar also came in for the grinding of food. There's also a comparison. This is deciduous and this is permanent set of teeth, upper jaw and upper jaw, lower jaw, upper dental arch and lower dental arch. Another comparison, 26 students, okay. And then we studied types of teeth, including incisors, canines, premolars, and molars. Incisors, they were central and lateral, more chisel shape for cutting. And then canine have cusps or projection, usually a unilateral cusp or unilateral projection here. And then premolars were having at least two cusps. So they were at least bicuspids or at least had two projections, and then molar has multiple projections. And then there is a wisdom teeth at 20 years of age, around 20 years of age, third molar. Okay, nothing to do with the wisdom. Just name, because we hope by now teenagers have some wisdom. Just a joke. So incisors, canines, premolars, and molars, and then incisors function as cutting or shearing. Canines for the tearing of food. They were at the corners of the dental arch. Then there were premolars and molars. Premolars had dual function, tearing as canines and grinding as molars. And then molars were only for the grinding, and that they are nearest to the TMJ, temporomandibular joint. Here canines, they say cut and tear food, cut and tear food up. So what about incisors? Incisors, they bring food into the mouth and let it stay in it and cut it. And other than cutting, canines tear it up. Premolars, like canines, tearing, like molars, grinding. And then we had molars for chewing or grinding of food. Can we move you up here? Okay. Next, Okay, tooth surface, there were apical, labial, lingual, distal, mesial, and incisal. Labial towards the lip, outer side, and inner to the towards the tongue was lingual. Mesial was towards the midline, where these quadrants are divided towards the midline, and then distal was away from the midline. For example, if teeth number 7, we take teeth number 7, this would be his mesial boundary and this would be his distal boundary, right? And then there is apical, incisal. Apical is towards the root, apex, oh sorry, not root, apex or root of the tooth, apical. And then incisal was the cutting or grinding. In case of molars or premolars, the grinding area will be known as occlusal. But here where there is cutting and cutting and tearing, incisal. Okay, or incisal. Apical surface pertain to the apex or root of the tooth. Apex, root of the tooth. Labial towards the lip. Labial, lingual was pertaining to the tongue, towards the tongue side, interior surface. Distal, away from midline. Mesial, M is towards the median line, midline. And then incisal for cutting, grinding surface. But for especially grinding, we have occlusal. How to write? Occlusal. Yeah. Okay. How many? 33 students. Okay. Same again, labial buccal, and then buccal was towards the teeth side, towards the cheek where there is buccinator. Okay. 3 parts of a tooth: anatomic crown, root, and pulp chamber. This pulp chamber. Pulp chamber houses the pulp, and then there is root canal or pulp canal. So the dental tissues, we have enamel, dentin, and cementum and alveolar bone as hard tissues. Then pulp chamber, gingiva or gingiva, periodontal ligament were soft tissues. Remaining odontoblast layer, pulp canal, apical foramen. So we have 4 hard tissues, 3 soft tissues, and 3 others. Okay. So enamel, dentin, cementum, alveolar bone. Enamel and dentin, you should know the outermost two layer, they must be hard to protect teeth from the outside. And then there should be cement. There should be cement to attach with the alveolar bone. Cementum is also a hard tissue. And then bone, alveolar bone should be hard, right? And then how to remember soft tissues? Pulpy is soft. Gingiva is gum, is also muscular tissue, soft. And then ligament should also be soft. Okay. Remaining, there is an odontoblast layer here just beneath the dentin and towards the upper surface of the outer exterior surface of the pulp chamber or pulp, and then pulp canals, right? And then apical foramen. Okay, and then cross section of tissues again: enamel, dentin, pulp, gum, root canal, bone, alveolar bone, and this bluish cementum. The whole this cements the teeth in the socket of alveolar bone. Okay, so incisors, canine, molar shift there, premolar and molar. Okay, perfect. So again, another a broad view, broad. Okay, so here cementum, you can see this is cementum. So dental tissues, 4 main types. So we start from here, today's topic, right? So how many students we have? 38. Okay, so 4 main tissues: enamel, dentin, cementum, and dental pulp. From here, enamel, dentin, cementum. hard tissues, right? And pulp, soft tissue, as we remember. So what's here? On the right side, we have a crown, the neck and tooth, basically crown and root, and then inside there is pulp, and inside there is pulp cavity. So here it is say it is made up of 95% of mineral as compared to other bones, which are made up of 70% of inorganic minerals. Then there is 4% water and 1% protein. What is the composition of a tooth? 95% minerals, primarily calcium and phosphorus. They form bonds together to form hard crystallites. That's why hard part, right? And then there is 4% water and 1% protein, binding proteins. Remember the composition of the teeth. 95% minerals, 4% water, 1% protein. Okay, so we start with the enamel here. So structure of enamel is enamel. They say, what is it? Why do we have it? What is the enamel erosion? How can I care for my enamel? Okay, brushing teeth. What can I do? What can't, what can I do if I have enamel erosion? Okay. So structure, highly calcified and definitely hardest tissue. We know this part, right? So highly calcified. Calcified how? We have calcium and phosphorus. Okay. Primarily calcium and phosphorus which bond together form crystallites. Okay, we remember this part. Highly calcified, hardest tissue in the body. One of the hardest tissue in the body is enamel. Crystalline in nature. How crystalline? Calcium and phosphorus bond together to form crystallites. Okay. Enamel rods. We have enamel rods. Okay. The histology part you will study in histology. Enamel rods. Insensitive. This is the part, outermost part, which is insensitive, that it does not have any innervation. Acid soluble, will demineralize at a pH of 5.5 or lower, which means pH less than 5.5 means 5.5 grams per pH less than 5.5 means towards 5 or 4.5 and 4, and then your carbonated drinks like cola and Pepsi and Fanta. This is not a commercial. So what is the pH of these carbonated drinks? Do you know? Definitely less than 5.5. That's why they help us in demineralization. Thank you, cola. And then because of this demineralization, because of these drinks, we get demineralized enamel, and which cannot be renewed. Important part, it cannot be renewed. So we need to take care of enamel. Darkens with age as enamel is lost, and fluoride and saliva can help with remineralization. So saliva helps. Okay, saliva has a lot of protective mechanisms, and salivary amylase and salivary lipase. Okay, thank you. But fluoride, any idea? Fluoride is found in our toothpaste. So people, beautiful people, make your teeth beautiful by brushing. Next. Enamel, continue. Enamel can be lost by physical mechanism. And then there is chemical dissolution, lesions formed by, also known as abfraction. And then there is multifactorial etiology, which is a combination of basically physical and chemical dissolution. So physical mechanism, abrasion. How abrasion enamel is lost? By grinding the teeth, or you don't take care of it. Okay, some people, some children have a disease, they grind the teeth against each other, which is a very ew. So they cause a mechanical wear. And then there is attrition, tooth to tooth contact, which I was talking about, by grinding the teeth together. Children usually do this. And then we have a chemical dissolution from the acid and extrinsic acid from the diet and directly from the oral cavity. So, for example, acid regurg, right? This disease, anyone knows acid regurg, a medical term, a medical disease known as, anyone? A disease in which acid regurgitates towards the oral cavity is known as
GERD, sir. Gastroesophageal reflux disease.
Good, sir.
perfect. GERD, yes, GERD. So, okay. So GERD, there is erosion of the enamel by the intrinsic acid from the oral cavity or digestive tract, and erosion by the extrinsic acid from diet will be by chemical dissolution. For example, some vinegars like
ERD.
very
ERD.
okay, perfect. Welcome. So we have vinegar, right? You heard about ACV, apple cider vinegar, and then some tea are very acidic, and then some vinegar, white vinegar, and which has low pH, acidic from the diet can also cause intrinsic acid erosion, extrinsic acid erosion. And then multifactorial will be just a combination of physical and chemical factors. No big deal, nothing new. Okay, so now if we go towards the right side, there is a comparison between surface stains and enamel erosion. So enamel erosion, there will be translucent, rounded edges. There will be yellowing, right? Yellowing, and then there will be tooth sensitivity towards the down region, because here we have innervation in the deeper tissues, but to the surface we don't have innervation because enamel does not have innervation. But these, when there is cavities formed, it reaches to the tissue below where there is innervation. So watch outs, citrus juices, here should be beverages, coffee and tea in excessive, okay, red wine in excessive, soda, carbonated water in excessive, sweets and berries, they all attract, some of them attract bacteria, some of them they have pH, low pH, acidic pH, cause abfractions, lesions, chemical dissolutions, like that. And discoloration will be just caused by certain food and beverages. There will be yellowing, which can be removed by brushing the teeth. Okay. Now, second is dentin. This is the second hard tissue of the dental tissues, but it is softer than enamel, right? So this one is softer than enamel, but still a hard tissue, susceptible to tooth wear, physical or chemical lesions. They also wear and tear phenomena. Okay, susceptible, does not have a nerve supply, but can be sensitive in the lower area, because next to them we have pulp, and pulp has highly innervation, is a highly innervated area. So dentin is next to it. So if we reach the cavity, there is a cavity formation. Cavity is tooth decay. One of the form tooth decay, it goes down, no pain, and then it reaches dentins, and then there is innervation, there will be pain. And then it is produced throughout the life. Thank you. It can be renewed, but enamel once lost cannot be removed. So this is a comparison. 3 classifications: primary, secondary, and tertiary. We have primary dentin, secondary, and tertiary dentin. Will demineralize at pH of 6.5 and lower. So enamel 5.5, dentin 6.5. Okay, the higher we go, the lower we go. So the higher the pH means it can be, so which cannot affect enamel at 5.5. If we don't have enamel, dentin will be affected by that, right? So enamel is more protective than dentin. So take care of your enamel, because dentin will demineralize even at 6.5, which is very close to 7. Water, come on, wake up, guys. Coffee, you know coffee, how much? Coffee is around 5. So coffee is damaging enamel, and if you are drinking too much coffee, your enamel is done. And next is dentin, and then it's very close to water, can't even water, right? So just you add water with lemon and your dentin will be affected. So enamel important. Next, that's how you remember. Okay, So there is reactionary dentinogenesis, and then there is reparative. Reparative means repair dentinogenesis. Okay, so this is a kind of process in which your dentin gets regenerated. Why it gets regenerated? Because it can because it can be produced throughout the life. So there are two reactions. So it can be produced, but enamel cannot be reproduced. Okay, let's just go into some part of this. Reactionary dentigenesis. Okay, mild insult. If there is mild insult, there will be no much damage. Then we don't need a repair. We will just need a reaction. So slow progress inflammation. What happens is bacteria goes to this odontoblast layer, the lowermost layer of the dentin. What happens is they cause the inflammatory factors will call immune cells, and then they repair. These also cells repair itself, the dentin. So these cells repair the dentin itself, and they also release some inflammatory factors. These are chemotactics, chemotaxins. They call chemotaxins of the immune cells toward it, which helps in regeneration, will bring the fibroblast, and there will be inflammation, right? You know, all the primary and secondary, or you say how it is called, early and late factors of inflammation, as you remember. But here is reparative dentinogenesis. What happens? Where is my cursor? Okay, can you come back, come back, come back, please? Okay, so reparative dentinogenesis. There is a severe insult. When there is severe insult, we have to act rapidly. So it rapidly progressing inflammation, same bacteria, it causes odontoblast and subodontoblast layers to release pulp fibroblast and stem cell niche. So they will cause a deep repair. So that's how reparative dentinogenesis takes place. Okay, so the main cells here for reactionary mild insult will be odontoblast, but here we have odontoblast and subodontoblast. This is done by immune. So reactionary is a reaction, that's why just immune cells, but reparative is a repair. So mainly pulp fibroblast and stem cells are required. Fibroblast to stop the damage and create a fiber layer, tough layer to stop the damage further, and stem cells to make more cells, later on changing into dentin. Next, three classification: primary dentin, secondary dentin, and then we have tertiary dentin or reparative dentin. Primary dentin forms the initial shape of the tooth. It's the outermost layer, initial shape of the tooth next to enamel. Excuse me. Secondary dentin is deposited after the formation of primary dentin on all the internal aspects of the pulp cavity. So here we have a perfect diagram. Outer is enamel. This part is enamel, and next to enamel, towards the outer side, is primary dentin, which gives tooth a shape, and towards the inner side, there will be secondary dentin, the orange one, right? I hope everyone can see. The light blue is primary dentin. Towards the outside, it gives shape, and then next to that is secondary dentin, the orange one. These two dentin form the physiological dentin, the anatomical, physiological, the anatomy and the functional dentin. The last layer will be tertiary dentin, and this is reparative dentin, which contains the cell. Next to that is predentin, containing the stem cells. Okay, so tertiary dentin or reparative dentin is formed by the replacement of odontoblasts in response to moderate level irritants such as accretion, abrasion, erosion, trauma, moderate rate dental caries, and some operative procedure. If we go back, accretion, tooth to tooth contact. Abfraction was the lesion caused by the chemical dissolution. These two terms are important. Abfraction are the lesions caused by chemical. Attrition and abrasion are by physical. Attrition is the T and T, right? Attrition has two T's. So tooth to tooth. So attrition has tooth to tooth contact, mostly seen in child behavior, abnormal behaviors. And then abrasion is another. So we have abrasion, mechanical wear, attrition, tooth to tooth contact, and then we have abfraction by chemical erosions. Perfect. Come on. Okay. So tertiary dentin or operative dentin is formed by the replacement of odontoblast in response to moderate level irritants such as attrition, abrasion, erosion, trauma, moderate level dental caries, and some operative procedures. Okay, so on the right side here we can see the normal part of our tooth and the sensitive part of our tooth. Okay, we have 10 minutes remain. So if we already know the normal, the sensitive, we have enamel, dentin, pulp, exposed dentin on the receding gum, inflamed gum, this side, this angle. And then we see if the dentin is exposed, dentin next to it is nerve, and then cementum is here. So this will cause sensitivity to sensitivity or pain, in short. Now we go towards the dentin tubules. Okay, so dentinal tubules, excuse me, let's draw. Can we draw, please? Oh, need to choose. Okay. Dentinal tubules connect the dentin and the pulp. So pulp is the innermost cavity or the pulp chamber, innermost part of the tooth, circumscribed by dentin and lined with a layer of odontoblast layer. Remember, outside we have odontoblast layer. And they also have stem cells to the predentin. So dentinal tubules connect the dentin and the pulp. So dentin and the pulp are connected by these tubules. These holes are outside. Okay, so we have this enamel outside, and here enamel is removed. We have started off with dentin, and dentin has these holes. These holes are dentinal tubules. Connect the dentin to the pulp. Connect the dentin to the pulp. So this is dentin. This is pulp. Pulp is highly innervated. You just see dentin is done. We have a lot of innervation nerve endings. Okay, so these are dentin forming cells. So this was the odontoblast layer we were talking about. This is the odontoblast layer just at the boundary of dentin and pulp. We have a layer, odontoblast layer. These are dentin forming cells. These odontoblasts are dentin forming cells. Okay, so we have this a big whole view. Dentin is made up of many tiny fluid-filled tubules through which sensation is transmitted to the dental pulp. So since if we feel hot and cold to a mild level, then this it does not mean our teeth are eroded or damaged. It just means that these dentin tubules has fluid which contain our sensation. But if we feel the cold and warm or hot too much, that in severity, the severity is high, then it means dentin and enamel is eroded or removed and demoralized. That's why we can directly feel the sensation through the nerves in the pulp area. The tubules run parallel to each other in an S-shaped course. Why S-shaped course? Because the teeth are like S-shaped, right? So S-shaped course, so like this, and then here we have S-shaped course, right? The bending of the teeth, and then these are parallel to each other. Okay, so they are talking about this, and when the angle of teeth come, these are still parallel. but they don't continue like this, don't continue like this. Actually they bend according to the shape of the tooth, but they are parallel to each other. Tubules contain fluid and nerve fibers. Nerve fibers, as you can see this nerve fiber, if you see clearly, going towards this side, dentin forming cells, and the fluid basically they are dip in the fluid, right? So we can get the sensation from outside the dentin. This fluid fill cavity takes it, the fluid takes it towards the nerve endings. External stimuli cause movement of the dentinal fluid, a hydrodynamic movement. This is a hydrodynamic movement. Dynamic means it can goes both way, increase the severity and decrease the severity. So for example, if it is not dynamic, it means one nerve will cause upward movement and one nerve will cause downward movement. But if it is dynamic, it means it causes both of the sensation both ways, right? So this, if we feel cold, it's also done by this dental. If we feel or decrease, both done by that. There's no extra, so it is dynamic in nature. Okay, so hydrodynamic because it has a fluid. Okay, so external stimuli causes movement of dental fluid, a hydrodynamic movement which can sharp pain episodes. So we have short sharp pain episodes if an external stimuli more than usual. If the external stimuli is more than usual, this will cause a movement of dentinal fluid, because dentinal fluid contains fibers of the nerve endings of the pulp, and which will cause short but sharp pain. So remember, this is short but sharp, SS. So again, dentinal tubules, presence of tubules renders dentin permeable to fluoride. These tubules helps in the fluorination. So the fluoride, because of the tubules, enter into inside, right? You can see dentinal fluid. Why brush? Because we have toothpaste. Toothpaste contain fluorides, and fluorides can this make it permeable. So this fluid is permeable to fluoride. And then there is intertubular dentin, and then there is nerves and odontoblast. Okay, predentinal layer, stem cells. So number of tubules per unit area varies depending on the location because of the decreasing area of the dentin surface in the pulpal direction. So it depends on here it will be more, yes, per area will depend on the area we are talking about. So here it is more concentrated. You can see this part, it's more concentrated, and we have here they are widely apart, but maybe the number of hair will be equal to this. It depends on how closely they are placed towards the pulp. 2 minutes remaining. Okay, so association between erosion and dentin hypersensitivity. Open patent tubules greater in number and larger in diameter. It means dentin hypersensitivity or oversensitivity will be there when they are open or patent tubules. The tubules are open, more in number and large diameter. This dentin tubule, if it is wider, more wider, it will cause oversensitivity of dentin, causing a short and sharp pain. And it also depends in the number of these tubules, right? And removal of smear layer, outer layer when it's removed, and then there is erosion or tooth wear. So dentin becomes hypersensitive in 3 cases: when there are tubules, dentinal tubules more in number and larger in diameter, if there is a removal of smear layer, and if there is an erosion, tooth wear, or cavity, or abrasion, accretion, abfraction, right? Okay. Now we have cementum. Okay, we will go for the cementum after the break. So let's do a quick hello. Let's do a quick hello. Okay, we have 45 students. Okay, this number changed quickly. Arsalan Majid.
Yes, sir, I am here.
Okay, you have any question relating to today's topic?
No, sir.
Okay.
It's
Okay, it's okay. Thank you. And then let's go for the Adnan Safdar, roll number
Yes, sir.
20. So, do you understand these erosion, the enamel erosion, physical
Yes, sir.
mechanism,
Alhamdulillah.
and then okay, can you repeat these terms, the erosion terms?
Physical mechanism and abrasion, mechanical wear, and attrition, to contact. And friction lesion are chemical dissolution, erosion by the extrinsic acid from diet, and erosion by the intrinsic acid. Like extrinsic